Welcome, everyone. For those of you who don't know me, hi, my name is Hillary Godwin, and I have the pleasure of serving as Dean of the School of Public Health here at the University of Washington. I'd like to get us grounded in a land acknowledgement. The University of Washington acknowledges the Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Suquamish, Tulalip, and Muckleshoot nations. With today being election day in the United States, I also feel it's incumbent upon us to acknowledge and honor those who died in the fight for our right to vote. While we think of the United States as being one of the world's oldest democracies, it's important to remember that universal suffrage was not guaranteed in this country until the Voting Rights Act of 1965 was passed, which I would say, for me at least, counts as sort of the birth of us being a true democracy. So if you get a chance, I'm showing here the lovely Ofrenda on the second floor in the kitchen in HRC. Ofrendas are a traditional part of the Mexican Day of the Dead celebration. The theme of this year's SPH Ofrenda is voting as a social determinant of health, to help us remember all the heroes who died in the fight to help us secure the right to vote. So please stop by this week to find out more about Day of the Dead and to honor the amazing organizers, activists, and suffragists who have walked on. Also, regardless of which candidate you support or where you stand on specific issues, I hope that you too will exercise your right to vote today, not only in the national election, but also in our state and local elections. This is particularly important because many of the issues that are central to public health are decided at the state and local level. Before we get into the body of the presentation, I'd like to thank all of you in the SPH community. I'm super grateful to have had the opportunity to work with all of you over the last 6 years, and I'm grateful to have the opportunity to continue to build upon our work together and eager to collaborate on opportunities and improvements that are open to us going forward. I cannot overstate the gratitude that I have for all of you and the resiliency, fortitude, and perseverance you show every single day to accomplish great work during challenging times. I'm also grateful to all of you who work so hard to further our vision of creating a world of healthy people by fulfilling our mission to solve our greatest public health challenges and co-create health equity with communities in the region and the world. Thank you to our students. Your passion, hard work, and integrity set you on a path to become the next generation of public health leaders, and you inspire me every day. Thank you to our faculty for embodying the positive change we all wish to make in the world through your groundbreaking research and the world-class education that you deliver to our trainees. Thank you to our staff for your commitment to making the world a healthier place and the work that you do every day to bring this to fruition. I particularly want to thank all of our staff who have worked over the last year in finance and grants administration. This has been a rough year for everybody, and you've done outstanding work in the face of a lot of turmoil related to our financial transformation at the institution. Thank you to our alumni for staying connected in our community, representing our school on the world stage, and your work that continues our vision and mission for the betterment of all. Thanks to our donors and our volunteers. Your support, generosity, passion, and pride for our school is invaluable and essential to our current and long-term success. And finally, thank you to all of our partners, both in public health practice and out in the communities that we aim to serve through our work. Our community-based approach to impact the world would not be possible without you. We appreciate your willingness to co-create solutions to the world's most pressing problems and to turn ideas into impact. So today, here are the things that I want to talk with you about. Given that it is an election day, I figure it's fitting to talk about the global and national context in which we find ourselves. And I do appreciate everyone who took time out of this election day to, to come to this talk or to listen to it online. We had a big conversation about whether we should schedule it on reschedule this for election day or not. And we finally landed on that. Maybe people would like something to distract them from the world stage. So I'm going to do a little reverse of that, which is reminding you about many of the issues that we're faced with. And also the challenging landscape that we face in higher education. I'm then going to focus in on our school and where we are and talk about some of the priorities, opportunities, and challenges that we face. And then do my favorite part, which is focusing on a small but mighty subset of the great ways in which our faculty, staff, and students and alumni have had impact over the last year. And then I'll leave some time for Q&A. So we live in interesting times. Sometimes over the last 5 years, it has felt like we have been pounded by one crisis or storm after another. You are all acutely aware of this turmoil because you, like me, are affected by it every day. This includes ongoing conflict in the Middle East, the Ukraine, the Sudan, and countless other parts of the world. It includes a bitter, divided political environment in our own country, where both sides argue that the other is putting the future of the country and democracy itself into peril. We also are faced with real and existential crises posed by climate change, including food and water shortages, which are exacerbated by supply chain upheaval. We're also seeing mass migrations that threaten to destabilize not only individual countries and regions, but the entire globe. However, we also know that historically, some of the biggest and most important societal shifts have occurred during times like this, during periods of tumult and upheaval. While these times are not always fun to live through, they provide us with an opportunity to take a step back and reflect on what is triggering all that unrest, and to reflect on how we might work together to overcome the forces that seek to divide us and chart a new path forward. That is what I'm going to be focusing on today. And it is what I'm asking of all of you, not only today, but in the months and years to come. To be clear, our varied perspectives, our different lived experiences, and our wide range of academic backgrounds are a foundational strength to us in the field of public health. And they are part of what we consider to be one of our core values, is that diversity of experience and perspectives. However, it is also our ability to work together while honoring those differences that allows us to achieve swing needed to solve the complex problems that we face in the field of public health. As I look out in the room and I imagine who's online, I'm comforted by the knowledge that while we may support different candidates in today's election or have different positions on issues that are of particular importance today, that we are all in the UW School of Public Health united by our commitment to making the world a healthier place and creating the circumstances that allow people to thrive. While I will be spending a fair amount of time today discussing the challenges that we face, I hope this conversation will help further your commitment to continue to work together and across differences within our community. Okay, so now I'm going to move on to challenges. One of the challenges that we face is that higher education is increasingly strained and under attack. During the last academic year, we saw the chilling and destabilizing effect of increased scrutiny from federal legislators on academic leaders and academic institutions. This past summer, we also marked the one-year anniversary of the Supreme Court's decision to limit the use of affirmative actions and admissions decisions in higher education. However, neither of these challenges are new to us at the University of Washington. We in Washington State have been subject to anti-affirmative action legislation in the form of I-200 at the state level for over 25 years. And we have learned how to work within these constraints and still achieve our mission and still adhere to our values. And we will continue to do so going forward. We also have the privilege of having an executive level leadership at the University of Washington who are committed to finding a balance between freedom of speech and creating a culture where all members of our community can thrive. And I too strive to help us find that balance. I may not, and we as a group may not always hit the right point in achieving that balance, but we can remain united in our commitment to trying to find that balance and trying to achieve it. I think that all of us also still have a sense that the field of public health is under attack. Trust in public health as a discipline was severely eroded during the COVID-19 pandemic, and we're starting to see that recover. However, in a recent study where individuals were asked specifically what undermined their trust in the field of public health, they cited both that individual agencies provided conflicting information during the pandemic. That was one major contributor. And a second major contributor was that were concerns about political influence on policies and recommendations. It's critical that we acknowledge and stay mindful of these concerns as we seek a path forward. Again, I feel privileged to live in the great state of Washington. While funding for public health is decreasing nationally, what we have seen in the state of Washington is strong support from our legislature for funding for essential public health services. And that is due in large part to the efforts of not just people in this room, I'm looking at you, Betty, but also our great leadership in public health practice who have spent years advocating for this approach and have really followed through on creating a platform to make sure that we continue to fund public health. So as a result, the opportunities for our students who are going out into the workforce right now in Washington State are tremendous. Another challenge that you probably hear frequently cited in the news and by others who are just worried about the situation is the national decline in demand for higher education. This is often referred to as a demographic cliff, although I have to say, if you actually look at the data, it sort of doesn't look like a cliff, it sort of looks like a little, but that still has profound impacts in terms of finances for all of us in higher education. This is due to a very real decrease in the actual number of 18-year-olds due to changes in demographics. That has resulted in nationally a multi-year decrease in enrollment in higher education, especially among men. Also of concern is an increasingly vocal percentage of individuals questioning the value of college, let alone graduate education. And again, I think it's really important for us to look at what is driving that lack of confidence, because we need to be thinking about that as we chart our path forward. So some of the biggest contributors to the lack of confidence in higher education are concerned that we in higher education have political agendas, that perhaps we're not teaching the right things, and the costs and expenses associated with higher education. And I guess I would say, again, these are things that we must be thinking about as we're thinking about the choices that we make, as we think about how we market our programs, as we think about what we teach and how we teach. While enrollments are decreasing in colleges nationally, the good news is that here on the University of Washington Seattle campus, our enrollments at the undergraduate level remain strong. And that is largely because we are the state's flagship institution of higher education. However, I just will note that that is not true for all institutions of higher education in our state. And we, as a partner to those institutions, still remain committed to their well-being as well as ours. And so when we make decisions at the campus level about admission strategies, they are influenced by both that national stage and the greater context of the state. And also our undergraduate admissions, which seem to be increasing quite substantially for many of the years that I was here, have really leveled off. So we just saw this year just a 1% increase in the size of our freshman cohort. It was the most diverse cohort the University of Washington Seattle has seen for their freshman class, which is great, but we're not seeing the big increases in size that we were previously. And then nationally, what we're seeing is that applications and enrollments in public health graduate programs are down. This is true both at the doctoral level and also at the master's level, very significant at the master's level. The one piece of good news here is that nationally, we continue to see increased demand for bachelor's programs in public health. And we see the same thing here in our own school. So the top line is our total enrollments as a function of time from 2016 to this year. This includes our fall census data from a couple weeks ago. And you can see that our enrollments rose rapidly, like many other institutions, at the beginning of the pandemic, and then leveled off. That is driven for us institutionally by our undergraduate enrollments, which are shown in purple. And you can see, as a scene nationally, we've seen a decrease in our master's level enrollments over the last 3 years. So that is a factor of concern for us because our tuition revenue is one of the major drivers of our operating budget and our flexible funds within the school. The good news is that we continue to see growth in our research activities. So we are currently in the top 5 in total funding amongst all public health schools in the nation, and remain in the top 3. We're always sort of like either number 2 or number 3. Number 1 is always medicine at the University of Washington, and we sort of bounce around in terms of where we are there. That continues to be the case. And if you look at the trends in terms of research funding requests, which is in purple, and awarded in gold, you can see, again, there's ups and downs. That's because every year there's just fluctuations in terms of large awards that when they come through. But overall, the trend here is quite good. Okay, so what are the challenges that we're facing? A big one that is true nationally and is true here for us at the University of Washington and within our school are rising costs, and specifically that our costs are rising at a more rapid rate than our revenue is increasing. So specifically, that has been driven by high inflation rates over the last couple of years, both nationally and globally. We have been happy that the legislature has provided merit, which we usually refer to as cost of living, increases for faculty and pro staff. Those come out of our own budget, though. So they tell us how much we're allowed to provide in terms of adjustments, but they do not provide a separate source of revenue to cover those costs. They come out of our existing sources of revenue. Also, and probably there are many people in this room who are in the same camp. I was super excited to see the new contract for ASCs provided much higher salaries over the next 3 years for our student employees. It is expensive to live here, and our students are at the low end of the income scale for the campus community. And so this is really important in terms of this being a place where they can thrive while they're in school. However, again, like the merit and cost of living adjustments for faculty and staff, those increases do not come with a new stream of revenue. So we are required to fund them out of our existing revenue streams. And then in the background of all of this, we are seeing increasing costs, both for central technology services like IT services, and also for things like the cost of finance transformation, and also our beautiful new building comes with costs, as does the health sciences education building. So those are all straining our budget. We also have significant constraints in terms of how we are able to grow our revenue going forward. As I mentioned, there are limits in terms of how much the total undergraduate enrollment at the University of Washington can increase. That's not just due to demand, but also being a good partner to others in the state. By statute in the state of Washington, and this is an outcome of very rapid tuition increases that occurred in 2012 after the Great Recession, the state legislature created a statute that reins in the amount that we're allowed to increase in-state undergraduate tuition costs. And so those increases are not keeping up with the rate of increase of what we use those revenues to pay for, which are predominantly salaries. As I mentioned, we're also seeing a decreased demand nationally for graduate public health degrees. And I would like to say too, a real constraint in our ability to increase revenue is our firm commitment to maintaining graduate tuition rates that are affordable. So our graduate tuition rates, both in our state-based programs and our fee-based programs, we do have the ability to increase those more rapidly than the undergraduate in-state tuition. Those we go through a process each year where we put in a request to the Provost's office and the Board of Regents saying how much we'd like to increase them. However, as I mentioned, our students are struggling to be able to afford the education costs that we have already. Increasing graduate tuition is not a great solution for us. We do not want our students to end up having even more debt when they graduate, knowing particularly that many of them are choosing to go into public service careers where they're not going to be able to make a lot of money. Okay, other challenges. I mentioned finance transformation. I would say this has been a huge source of stress for pretty much everyone in our community. I mentioned the burden and stress for our finance staff. I know this was also felt acutely by anyone who had research grants or anyone who had a budget for a center, a program or department, a school, a university that was trying to understand where the money was coming from and where it was going in the last year. It effectively has meant that we've had a year-long blackout in financial reporting. It has also really impacted grant submission and administration in ways that are not helpful. So I want to give a huge shout out to all of you who, in spite of all that, still managed to get grant applications out and to pursue additional funding, given how additionally complicated it was. And again, just incredible burdens for everyone institutionally. And we're not out of the woods yet. So yeah, Jerry always is like, and we're not out of the woods. It's not solved. So I do, I feel like we are in a better place. For those of us who weren't tracking it, there was a transition earlier in the calendar year where the Office of Finance and the Office of Planning and Budgeting merged into Office of Finance, Planning, and Budgeting. And that office also was then given oversight for managing the system that we transitioned to under financial transformation, which is called Workday Finance. They have been so much more transparent about what's going on and so much better about providing metrics that we can track and follow and providing data on whether we're achieving those metrics. We are still not where we want to be. They are very clear that we are not where they want us to be, but we are making progress forward. So that is an ongoing challenge. And then finally, I would say there's also, I mentioned that we have significant increases in IT costs. Those are necessary and real costs that are coming from central, but also reflect needs in our own community. So you cannot live in this world without recognizing that there's significant cybersecurity threats that are at a level that we had not experienced previously. We are also challenged with wanting to make sure that we're preparing our graduates to be able to face the needs of the practice community and research communities in terms of like IT skills, data science, and at being able to ethically leverage AI. And those are all challenges for us as well. So where does that leave us? Despite all of that, I would like to say, like, absolutely, positively, we are still in a really good place. So our overall state of our school is still strong, and that is because of all of you. It is because of the people in our community, our approach to research and education, the values that we provide to public health, our communities, and the world. And I tell you about these challenges, not because I'm trying to depress you or because I'm trying to make you discouraged, but because it is truly the way that we will get past these challenges is by naming them and talking about how we are going to work past them and through them. So that being said, I want to talk a little bit about some of the strengths that we're going to leverage as we work in that path forward. So again, I absolutely believe that all of you are a huge strength. Since the day that I came here, before I came here, have been incredibly impressed that this is the only R1 institution that I know of that has a dual commitment to both training outstanding researchers and training outstanding practitioners, and training researchers who appreciate practice and practitioners who appreciate research. And that is an incredible, incredible strength that we have. Our methods to research to practice approach, where we engage communities in creating the questions that we want to study, as well as the solutions, as we try and turn those very basic science and innovations into real world impact, that too is an incredible strength for us. That is absolutely dependent upon us having strong community partnerships. And we absolutely thrive in terms of our ability to work with not just practice partners, but also community-based organizations that are embedded in the communities that we wish to serve. And then finally, again, one of the things that keeps me going in this job, and I hope continues to motivate all of you, is the deep commitment of our institution, our school, and all of you to having real world impact through the work that we do. And again, I cannot emphasize strongly enough, if we are to navigate these challenges that we face successfully, it requires us to work together and across the differences that we have. That doesn't mean ignoring that we have different perspectives. It means celebrating that we have different perspectives, that we have different lived experiences, that we have different approaches. It means that we need to continue to focus on supporting each other and respecting and cherishing each other. We need to continue to maximize our collective impact and continue to focus on where we have shared vision and values and where we can continue to work together to achieve more than we could individually. So what are my particular priorities as we go into the next year, the next 5 years? One particular priority is our ongoing commitment to supports for research. So I want to give a particular shout out to Jerry Cangelosi, who's our Associate Dean for Research, and Jade Pierce, who's probably here somewhere, for their work launching this new training grant consortium, which is really important in terms of we need these types of supports for our students, and also recognize that it is a huge lift for the faculty and staff who manage those programs. So really leaning into how we can support you in that work. We've also had great work. I want to mention in particular Janet Baseman and Ali Shojai, who were leaders in our collaboration with the Department of Health and the other health science schools in developing a summit in August on AI. And we are continuing with that work of how to leverage AI, particularly to achieve problem solving in the field of public health that might not have been possible without it. And then again, thanks to Jerry, and I'm sorry, I'm forgetting the name of your graduate student. Thank you, Renee, for launching the first Center Discovery Expo last year, and a reminder that the second ever Center Discovery Expo will occur on March 7th in the coming year. Some of the ways that we have focused on trying to maximize the impact of our resources for research over the last year have been, I know it doesn't feel like it, but we have really invested in finance transformation support. And so we obviously are going to continue to do that. And that involves not just supporting all of you, but also partnering with Central to make sure that they are working on developing the tools that we need in order to do our work. Additional piece of work that was done this year was a database to help connect students with PIs for minority supplements to NIH grants. And then for those of you who are not aware, we have over the last couple of years really rolled out support from the Office of the Dean for large center and training grant applications. If you are thinking about applying for a large center grant or training grant, please do reach out to Jerry to hear more about the types of supports that we can provide. Couple of things that we have on the docket for this year. We are planning to launch, so this is the last year of our current strategic plan. So we're not doing a big strategic planning thing. We're really like rolling up the last 5 years and getting ready for what next year will be new strategic planning. But the one area of strategic planning that we want to engage all of you in this year is around research priorities and priorities for fundraising. And then in addition, again, coming back to the finance transformation support, we're really focused on trying to streamline the research process and decrease the burdens. That some of that is work that we hope will come from Central in terms of the new financial system, but please do continue to communicate with us and let us know how we can decrease the burdens that have emerged or chip away at ones that have been long existing. We are also prioritizing this year some really important work around budget transparency and alignment. It was very clear to me from my 5-year Dean's Review that people wanted a greater sense of collaboration and transparency about our fiscal processes. We have set up a series of different consultations that Craig Brownson, our Assistant Dean for Finance and Administration, and myself are engaging with different stakeholders on. We have been working through a series of different budget convenings with the chairs and faculty council and our department administrators. In addition, we have scheduled to come to each of the departmental faculty meetings over the next month to talk specifically about like giving you a deep dive into where we are in terms of finances and where we need your help partnering in developing good solutions to develop long-term financial resiliency for the school. We are also launching some budget working groups to focus specifically on opportunities and research and education, and also reporting needs to help us move forward in a better evidence-based way. And we'll consult with all of you in terms of developing a shared set of guidelines and considerations for budget related decision-making. Overall, our goal here is to have a budget that continues to absolutely stick to our vision and mission and support our values and community priorities, but will give us the kind of resiliency that we need to be able to move forward and work on the important problems that we are all committed to. I also am interested in hearing from all of you. So again, one of the things I heard loud and clear from the 5-year review was a desire for having more opportunities to have conversations with me and for me to hear from all of you. So as a result, we are doing quarterly listening sessions by stakeholder group. So for this quarter, we just had the student listen and learn session, and we have an upcoming one for staff on November 21st. There will also be an email that goes out with all of this information later today. and for faculty on December 2nd. And we likewise will have similar sessions in the winter and the spring. I also want to emphasize that I do have an open door policy. And if these times don't work for you, you'd like to meet with me individually or in small groups, please reach out to me and or to Deshauna in terms of scheduling, and we will find a time for that conversation. Oh, one more thing. So during those listening sessions, it's really important to me to be able to understand what the things are that are concerning you. So I just want to encourage everyone to please feel free to be very direct. It is very difficult to offend me. So don't worry about that. I really appreciate and thank you in advance for being willing to be honest, open, and direct. There are things that came up in the 5-year review that I and the team are working on addressing, but there are other things where I just would like to have an opportunity to understand better what the concerns are that people have. And these listening sessions are really geared towards trying to get that understanding. Okay, so now to the fun part of the presentation. So first of all, I want to welcome and thank individuals who are taking on new leadership roles in the school. Haiti Van Ryan started on October 1st as our new chair of the Department of Global Health. Leanne Shepard started as interim chair for DEOHS on September 1st. Liz Kirk transitioned this summer, I'm not sure the exact date, but from interim associate dean for education to associate dean for education. And Stephanie Farquhar, as of October 1st, has taken on the role of interim associate dean for faculty. We also have not as many new faculty this year as we have had in previous years, and that is largely due to budget reasons, which we will talk about in the individual faculty and staff meetings. But I do want to welcome the wonderful new faculty that we have, both that came from externally, but also we have a couple of folks who were previously adjunct faculty in the school who are now joint faculty, which is fantastic. I also want to thank this year's faculty council, both the elected members who are shown here and also the alternates, who I don't think are shown. Let me see. No. And also the alternates who are not shown, who have been really collaborative and really digging in and spending a lot of time with both me and Craig and the chairs and the department administrators doing a deep dive into the budget this year. Okay, and now I want to talk about some really great impact that all of you are having. And I've divided this up by department, just because we often talk about it in terms of department, but obviously you're all part of the same school. So biostatistics, we particularly wanted to give a shout out to 2 of our students who got great scholarships and fellowships, Kat Hoffman and Katie Paulson. There's so many different research accomplishments in each department in the school. So we just had to focus in on 1 or 2 from each department, but wanted to highlight this really cool new methodology that was developed by a group that was led by faculty in our biostats department for pinpointing genes involved in disease causation. And then a second project also led by faculty in our biostats department on new models to improve cardiac risk prediction. In environmental health, again, super hard to choose what to highlight here. But one thing that I wanted to lift up is that we have 2 fantastic new federally funded centers within the Department of Environmental and Occupational Health Sciences, one focusing on environmental health equity and another focused on public health emergency preparedness and disaster response. Leanne, in addition to taking on the role of interim chair for the department, just ended her 3-year term as chair of the EPA's Clean Air Scientific Advisory Committee, which is just a monumental public service, and we are so grateful to you for that. And then one other faculty research item from the Department of Environmental and Occupational Health Sciences, Sarah Collier, who's one of our assistant professors, in that department and in food systems, nutrition and health brought in a great $5 million grant from the USDA to work on food system resilience. In epidemiology, we have to mention that Ali Rohani Rahbar was inducted into the National Academy of Medicine. Shirley Beresford, who's an emeritus faculty member in Epi, and her colleagues were awarded Article of the Year from AJPM. NAC, the National Alzheimer's Coordinating Center, brought in a new $7 million award to coordinate data across the national Alzheimer's centers. And our alumnus from that department, Claire Rader, received a Fulbright scholarship to work in Columbia. In global health launched the super innovative Partners Advisory Board that's really focused on how to engage in equitable and respectful collaborations with partners. Their e-learning program celebrated its 10th anniversary. They've enrolled more than 160,000 participants in their programs today. Rabi Yunusa, who's a faculty member in global health, received the MLK Junior Service Award this year. And this is like, I don't know, the 5th or 6th year in a row that a faculty member from global health has gotten that award, so which is amazing. And doctoral student Amanda Brumwell was one of 2 students this year who received from SPH, who received a Magnuson Scholar Award. In HS Pop, again, really had a hard time, and I know people are going to be like, what about this? And what about that? But I wanted to call out Ria Francisco receiving the SPH Anderson O'Connell Award for Outstanding Staff, again, for their work in grants administration. ARCH, led by Wendy Barrington, has collaborated with the School of Nursing, and I know other folks have been part of this as well. India, I'm looking at you, to launch a 4-part Train the Trainer series with Crystal Fleming on anti-racist pedagogy that's ongoing. We have another student, Mariana Duran, who also received a Magnuson Scholar Award. And then student Frankie Shelton also got a Fulbright, in this case, Entrepreneurship Award. I also, again, want to come back to our strength in terms of community partnerships. Huge thanks to those of you, Janice, who worked on making, and I guess Dennis too, making this mapping project a reality, and all of you who responded to requests for information. But we have documented almost 900 active partnerships and projects across the globe with different community organizations. Okay, so finally, I want to come back to the fact it is election day. We have lots of resources that are available to you as you're processing today. And as I let you go back out into like thinking about the world around us again, I did want to highlight in the middle here, the 2D barcode is for the Provost website for UW resources for navigating the election. Included on that website and shown on whatever side that is for you. I think you're right, because it's my left. Some really incredible resources that Jen Wen and her colleagues over at the Counseling Center developed, helping people to themselves deal with politically charged news and also support each other through this time. And then finally, I did want to mention that upcoming next week, ASPPH will have a webinar about policy implications about the election, and encourage all of you to log in for that. As we move out of the frenzy of election and into the reality of we have a lot of work to do within the field of public health, I hope that all of you will join me in focusing on what are the things that we all can work together on to promote a healthier future. I also recognize that people may just want some time to be together in community. So we have set aside space in HRC 797 tomorrow, Thursday, and Friday from 8 to 9:30 in the morning just have coffee and have an opportunity for people to gather. You don't need to talk about the election. So invite all of you to join us there. And then finally, just again, to really thank all of you for all of the work that you do every day to make the world a healthier place. I appreciate you all attending this event, whether it was in person or virtually. I'm really excited to see that lots of people turned up. I know this is a hard day. We were hoping that this might just be an opportunity for people to be in community with each other. So I hope you found it to be that. Many thanks again to our new and interim leadership. I'm looking forward to building a stronger future in the school and the world with all of you. And just want to reiterate how incredibly grateful I am for the opportunity to continue to serve as dean of this incredible school. I know we have a lot of challenges ahead of us, but we also have a lot of great opportunities. And I'm looking forward to working with all of you. So with that, I'm going to turn it over to Q&A. Thank you.
Two ways to make questions for this Q&A. If you have any questions for the room, please raise your hand over the microphone. Ask a question. Possibly going to repeat the question to people online here, or also allowing people who are on the Zoom to submit questions. Yeah, there.
And just for the people online, I'm not looking at your questions, but Craig and Alex will sift through them and bring them to me. Any questions in the room while they're looking at questions online? Really? Nothing?
Hearing that it's difficult to hear Alex. Me and the people on Zoom, sure.
Okay. So what we're hearing is that the handheld microphone that Alex has, while it is good for us in the room in terms of hearing what people are asking, is not great for people online. So I will make sure that I will rephrase any questions that either come from that Alex brings up online or that people using the handheld mic in the room provide. With that, does anyone have any questions? I know one question that came up this morning and I didn't have the answer to, but I believe you do. Someone asked whether or not this was being recorded and will people have access to it? What's the answer to that, Alex?
Yes.
Probably not so important for all of you who are in the room or online, but the answer is yes, it is being recorded. So if someone says, oh, darn, I missed that, or I wish that hadn't been scheduled on election day because I really was preoccupied or whatever. Yes, it is being recorded and it will be made available. Yeah, Stephanie. Yeah.
You know, I was going to ask who you think will win the election. Can you talk a little bit about the listening segment, how they're structured, and people show up for days to bring questions?
Yeah. Yeah, so for those online who might not have been able to hear Stephanie's question, she asked if I could explain a little bit more about the structure of the listening sessions and whether people should arrive with questions or what was the intent of those. So yes, I encourage people to arrive with questions if they have them. That being said, if people show up and they're like, I'm not really sure what my questions are, or I'd just like to hear like more about what happened in the 5-year review and like what your reflections are on that, I'm totally happy to talk about that as well. So I will bring those notes with me So if people just sit there and they're like, I don't even know where to start, I can at least get the conversation started with that. Yeah, Betty.
I heard rumors, maybe, so hopefully it's just a rumor, but
Mhm.
rumors go around. That the University of Washington has like tens of millions of dollars that are unaccounted for. Due to the. Is that
Okay, so Betty's question was, she said she had heard a rumor that she's hoping was a rumor that somehow there are like tens of millions of dollars missing somewhere in the university due to FT. So Betty, I have not heard that rumor. But I will say, I have not heard that rumor, so I'm not trying to lend any credence to it. I will say, just as all of you have found it extraordinarily challenging dealing with like seeing what's going on with your individual grants, we're seeing the same thing recapitulated across all levels in the institution. And that doesn't mean that money is necessarily missing. It's that we have a disconnect in terms of our, like, what our historical accounting system and the new accounting system. So I guess I would say breathe, like we're not where we want to be in terms of like having everything working in terms of reporting where we would like it to be. But we are moving in the right direction. So, but no, I had not heard that rumor.
not for the.
Okay, yeah,
No worries, this is a little long, but.
yeah,
This is from Stephen Richard. I appreciate your perspective on working to make the world a healthier place. Our HBC situates us as a less healthy nation than over 50 other performance in terms of life expectancy and accepted measures of health. There are studies to release this and next month. We are talking health status and protected students will be less healthy than over 60 other nations. This is not good news. In spite of these data proving their death first, we do not have a response to this. The greatest crisis in the cases, being their table health status. School is not this. Only one course, DHS copy 40 covers this. What's this?
yeah. So, okay, so for those who are online who didn't hear what Craig had to say, it was a question from Stephen Brzusca, and I'm not going to repeat it verbatim. But it was pointing to that there's a new study that's coming out in the Lancet from IHME that looks at both national health, no, I know. The national, comparing us nationally to other nations, and it also includes actually really great drill down data at the state and county level as well about morbidity and mortality. So I would just say, like, if you don't know that's coming out, check it out because it's a really fantastic data set and should be very powerful. And Stephen's point was like, what are we doing to sort of really get the word out about our lagging health status in the United States compared to other high income countries? And both get the word out and to change that. So I would say in terms of trying to change it, I feel like there are many people in this room who are working on that on a daily basis. In terms of trying to get the word out, I will give a small plug for, inspired by Stephen, that I am doing open mic night on Bainbridge Island and the Rainforest Cafe next Tuesday at 7 p.m. And I'm talking about exactly that. So like, Stephen, I have taken like your chiding to heart in the past, and I do agree we need to get more information out. So they're my guinea pigs. I know you're like, that's kind of a small venue, small but mighty, important. My hometown. So if you're on Bainbridge, totally welcome to come. But yeah, I'm sort of trying out a new approach to talking about this topic. So my hope is to take the show on the road. Should it be successful? And if it's not successful, I guess I'll retool before I take it on the road. Yeah. So,
Yeah.
Yeah.
One question on from Jen Slider. Can you share those opportunities for faculty advocacy around bigger picture revenue / funding opportunities for school? I'm thinking things like legislative advocacy, looking at funding structures, indirect rates, negotiations, etc.
Yeah, so thanks. That was a question from Jen that was wondering how faculty can engage in conversations that we will be having across the school about both opportunities for cost reduction and opportunities for increasing revenue generation. But she wanted to engage in revenue generation ideas. So some of the things that Jen pointed to, like indirect cost recovery, at the from the feds and also from the institution to our school. Those are things that we don't have control over in terms of levers as a school. However, I understand that faculty have a lot of questions about it. And so what we are doing is setting up a series of what we're calling budget working sessions that involve the chairs, department administrators, and faculty council. And where possible, we are recording those and we'll make them available to all of our voting faculty. So keep your eyes open for that. So because for instance, some of the questions that were just raised there were answered in a session that we had yesterday with folks from the Office of Finance Planning and Budgeting about UW's budget model. And so that will be the first of the sessions that will be made available to the voting faculty across the school. We also, as I said, are coming to each of the faculty meetings in each of the departments over the next, hopefully, month. Most of them are in November. I think one's in December, maybe two are in December. And having that conversation with the faculty directly. And we'll be talking about some of the working groups that are available. And we would love to have folks volunteer for the working groups. Or if you want to be nominated, talk to your department chair. We've asked department chairs to nominate folks. And then also, we've been doing some going around and gathering input from specific groups as well. So Craig and I met with, for instance, the program directors and program managers to do a brainstorming session. And if you have suggestions of other groups of stakeholders that you would like for us to meet with, we are very open to coming in and doing some brainstorming with you. So yeah, very much look forward to both having a conversation, but also getting input from all of you. Okay, I'm getting the note that we are out of time. I'm happy to answer your question one-on-one though. I'm gonna hang out here. So if people want to talk more, feel free to come up or I'll walk over to you. And again, thanks everyone who showed up either online or in person. And stay healthy, focused, positive, thinking about how we're going to work on public health issues as a community going forward, regardless of how things pan out today. So, thanks.